Venerable Sirs, Director of Public Health, and all the medical fraternity and all the other people from other disciplines, I hope not to take much time. And we are hearing so many things from different people, need not be all related to medical science. Our sir started with evidence-based publications or what we should do. And next thing we heard about a specific disease or cervical cancer. And we just now heard about publications. And now we'll be hearing, I was supposed to talk on capacity building among the PHNs or the public health workforce. Maybe I happen to be a teacher, so I'm starting from little definitions or little concept. Like if you ask a doctor, are you a professional? Definitely they will say yes, right? But I think as our Director of Public Health said, here there are a gathering of so many varieties of people, right from PHN, health workers, pharmacists, and so many people are here. So it's a collection of different people, and we have all come with some purpose. Maybe we came to please our higher boss, or we just wanted to have a certificate we came, or we wanted to really gain something from some knowledge about something, right? So now this capacity building is also something about gaining something for our personal use and for a professional use, as simple as that. Now, I just wanted to say what is a profession, because sometimes when you ask people, are you a professional, they may think twice. For a doctor, it's not a problem. For a lawyer, it's not a problem. For an engineer, it's not a problem. But to a pharmacist, an allied health person, it becomes very difficult. All that I want to say is, anyone who is trained for a particular purpose, for a specified purpose, based on that purpose, I call that person a professional, right? Legally speaking, there are so many differences, but if you are trained with a specific purpose, specific knowledge, and specific skill, you are a professional. And small change or a differentiation between occupation and professional. This occupation is anybody who is working for their living, where they serve to live. But whereas professionals, they live to serve with ethics, and they have specialized knowledge and specialized skills. Now, this is the concept I am supposed to talk. Now, who are the people, right, in capacity building? There are individuals, there are organizations, then there is a profession itself. So they are the people who come into the play, and there is a process of acquiring some information, then enhance what is already possessed, and then you retain whatever good or positive things you have learnt in a particular profession. Now, I think I heard that so many papers were being presented, more than 200 papers, which means so much of knowledge is being presented by maybe a small one finding, but it is an important finding which the participant must retain, then go back and present it. And what do they retain? The resources, the knowledge, even change of attitude, skills, policies, and leadership. These are the things we learn when we go through this kind of exercise of attending a conference. And what is the ultimate goal of this capacity building is to achieve goals. We have many goals in health department or institutional goals or departmental goals. So all the goals need to be achieved. Competence need to be increased. Then you need to adapt change. It's a very important point. There are some people who don't want to change. So when we increase our capacity, we need to change ourselves or change our thinking, change our practice, and put into new things whatever we learn, and so that we can thrive longer in a profession, or we take the profession for a better position. These are some of the capacity building things in the government. Now we know e-governance, Digital India, Then community, we have a lot of things where previously what they were only receiving people, right? Now they are participants. People become participants. Society becomes a participant in the healthcare. So these kind of capacity building. We not only the professionals but also the people, we educate them so that they participate in a better way. And this is in short, right? Capacity building helps. It equips the individual, meets organizational goals, and it also enables, provides a good environment for the person to achieve these goals. What does the individual gain? They gain knowledge, they gain skill, and they change their attitude. Now, what does the organization gain? Right? They also need capacity building. In which way? They need to talk about their structure and systems. They need to talk about their management and accountability. They need leadership training. Then the climate that need to be maintained in the particular situation. And in all these things, how to mobilize the resources. So these are the things which are required by organizational people or in organizational dimension. Now, there is an environment that shapes, right? This, when we talk about capacity building, there is something environment which shapes. What are the things that shape policy and legal framework, right? It is not simply I know something, I want to do something. No. We are governed by policies and legal thing. And then we have a partnership with networking ability we should develop when we develop our capacity. Then there is sharing of knowledge and information, and the movement among the group is fully democratic. And these are the dimensions. To briefly say about what happens, how this capacity building functions or moves on, is something, it is a coordinated, at the bottom you see the coordinated approach. There are 3 arrows here, and it starts with the individual skills, for which that person needs supportive organization. The supportive organization needs conducive policies and legal frameworks so that whatever they have learned can be implemented and sustainable goals and efforts and changes can be brought forth. And in order to have this capacity building, we need continued professional development, which means you need professional growth, like paper presentations, like you have televised surgeries, okay, and so many ways of promoting the knowledge from or the skill from one area to another, professional growth, career advancement for individuals, organizational benefits, and improved performance. I will just run through this continued professional development. First of all, we need to keep update. That's the purpose of this continuous professional development. You can't be old styled. We need to change to the newer skills or the newer findings. Then improved performance. We close the gaps in your skill. You boost confidence in the performance. And above all, you solve the problems quickly. Time management, how effective it is, how cost effective it is. So these are some of the effect of this continuous professional development. Then career advancement for every individual. Once you qualify in certain areas, you become eligible for a promotion, or you can look for various avenues of opportunities in work. And organizational benefits, they include it fosters a professional culture, promotes innovation. Nowadays we talk so much of innovation even in health science, right? Engineering people, they had a lot of hackathon, but now newly we are hearing about the healthcare hackathons, right? Previously we were not worried about those things, or we were so much concerned about within the 4 walls or something like that, but now we are going for interdisciplinary and so many other varieties of inventions. That is the innovation. Then it definitely gives, employee satisfaction, and we attain goals. These MDG goals are there, right? Now I think we are very well actually doing this job, Maybe I'll skip all this. I'll just read the headline, okay, so that if at all any of you want to have a continuous development program, we need to have first of all a plan for it. What do you want? First of all, what I'm lacking. It can be known from our supervisor or by observing others, what do I lack? Then you decide whatever you want to do, that is setting goals, right? What I lack, where will I get, when will I get, which area or which specialist I can, which institution I can contact. Then you create a plan which can be immediate and long term. Then you can go for a formal learning, right? You can get a certificate by a formal informal learning by this podcast, attending webinars. All these are informal way of generating information and skill for you. Then learn from others, then learn on the job, which means you can overshadow, you can learn, practice and shadowing of some of your colleagues. That is a concept. Then please record whatever you had learned. Okay, it is not just attending a workshop or seminar. Keep a record, document your activities, what you have gained, what did you learn, who provided you everything. Then track events. I think medical council, nursing all request credit points to upgrade or definitely keep track of it. Then reflect on the impact. What did you gain? What change you were able to accomplish? Then update, identify future needs. Now I have gained something. What I can do from this? That is, you can plan from whatever you have learned. Then stay flexible. Don't be very hard on you. Stay flexible to learn or to guide or even to learn. Now these are some of the continuous professional development areas: Indian Nursing Council, Tamil Nadu Nurses Council, National Program for Technological Education and Learning, ICMR, National Health Missions. All these are providing you online education, okay, for your continuous education. And these are some of the examples. Okay, now all of us are talking about artificial intelligence, right? How I can use, as a teacher, how I can use artificial intelligence. As a surgeon, how I can use. As an engineer, how can I use. As a pharmacist, how can I, by using artificial intelligence, I can minimize the wastage of time and increase the cost effectiveness and better patient satisfaction and so forth. So there are so many things just I have listed down. These are all, many of these things are already in vogue and I have just mentioned it. And finally, we need to assess. These are the things after you go through a process of attending some conference or whatever steps you have taken, find out whether you have done it relevantly, okay, then whether it was effective, how efficient it was, how sustainable. That's very, very important, not just learning and getting, continued. It should have a sustained effect in your practice, how it gave you behavioral change, and what impact it gave for the people, for the organization, for your individual. So with these few words, I would like to thank you for the opportunity. Thank you.